Hello everyone, my name is Abuzar Asif and I'm a third year internal medicine resident at University of Illinois College of Medicine in Peoria. Today I'm going to discuss my research project titled Does BMI Influence the Severity of Clostridium Difficile Infection? Just to give you a short background, we have seen that obesity decreases colonization of gut-friendly bacteria, that is Bacteroidetes, and relatively increases colonization of bacteria Firmicutes, Proteobacteria, and Actinobacteria. We often see similar changes when we use antibiotics. As we all know, Clostridium difficile belongs to the phylum Firmicutes. So we hypothesize that individuals with increased BMI that is greater than 25 would be more susceptible to a severe Clostridium difficile infection. We therefore conducted a single large center retrospective study on our OSF St. Francis Medical Center, and our objective was to determine the association between BMI and severe Clostridium difficile infection. Clostridium difficile infection can be classified as severe when white count is greater than 15,000 or serum creatinine levels are greater than 1.5. We categorized our patients as underweight, normal weight, overweight, and obese. To examine the association between the primary outcome, the factors like age, gender, albumin level, ICU admission, antibiotic use, diabetes, and hypertension were also considered. Our initial data was obtained on 1,000 patients, and all these patients were admitted at OSF prior to May 2020. Our exclusion criteria was patients with chronic kidney disease, active malignancy, ongoing immunosuppressions including chemotherapy, end-stage liver disease, pregnancy, inflammatory bowel disease, previous GI surgeries. All our statistical analysis was performed by a statistician. After meeting the exclusion criteria, 219 patients were included in our final study, out of which 106 were males and 113 were females. Of these total population, 115 patients had severe Clostridium difficile infection, and 103 patients did not have a severe Clostridium difficile infection. One patient's severity of the disease could not be determined. Our results showed that when compared to normal weight patients, risk of severe Clostridium difficile infection was not influenced by being obese or underweight or overweight. Males had higher odds of having severe Clostridium difficile infection when compared with females, and this was statistically significant. We also observed that with every unit, that is 1 milligram per deciliter increase in albumin, the odds of having severe Clostridium difficile infection decreased. Therefore, albumin levels greater than 3 were associated with lower odds of having Clostridium difficile infection, with a statistical significant result being shown. Patients who required ICU level of care were associated with higher odds of having severe Clostridium difficile infection when compared with the non-ICU patients. We therefore conclude that BMI of an individual does not appear to be associated with the severity of Clostridium difficile infection. Thank you and have a good day.